Hey guys, it's Ted Bogert with The Ted Show. Good morning, good afternoon, wherever you're at. We're very excited that you're here. I think you're going to love this topic. You're certainly going to love this guy. This is my friend Dr. Saied, otherwise known as Sam, with Advanced Preventive Medicine and Urgent Care. Very excited to talk about preventive medicine, about addiction, which we will talk about too, and then to get to know Sam. To know him is to love him, and I think you guys are going to love the information that he provides all of us today. So welcome to the show, Sam. Good to have you.
Thank you so much. Good morning and good afternoon,
That's
everybody.
Right, wherever you're at. So tell us a little bit about you. They always love to hear origin story. Being a physician is a long journey in and of itself. So tell us a little bit about you, your beginnings, and kind of how you got here.
Yes. I'm from Iran. I'm a physician that I got trained in Iran in trauma surgery and emergency medicine. And after that, I decided to go to France and do subspecialty. So I learned French.
That's why you know French. I was going to ask you earlier, but I figured I'd save it for the show.
And then I passed the medical board in French language. So at that moment, I had a chance to immigrate to the United States. So I had my green card pulled up. So I decided not to go to Europe. Then I came to the United States. And I started the journey to go through recertification and board certification again in the United States. And I did it. And I was...
Another country that you had. Did you know English before you got here?
Yeah.
Okay.
I had to pass TOEFL exam.
Wow.
Even before going to medical school. And basically in Iran, medical schools are based off American medical schools and all the books and everything in English. So yeah, pretty much.
Very cool. Very cool. So what brought you, like I love France, so I'm trying to figure out what brought you from France to over here. Was there an opportunity?
Yeah, the opportunity actually, because I had the option to get my citizenship from the United States. So I said, well, I may go to the United States. So I forgot about the French story and French opportunity.
But not the French food or the language.
But I came here and I started doing my board certification in the United States, and I got trained again in emergency medicine, which I really loved. With a passion and my background from Iran as a emergency medicine doctor and trauma surgeon. So I got my certification again here, and I had the opportunity to go to Puerto Rico for training as well, for doing my internship. That's why I speak Spanish as well.
See, you have how many languages? I can barely speak English, so you have a lot of languages you speak.
So
why emergency care?
I like emergency because it's a fast pace and the way that you can see different varieties in medicine. If you're subspecialized in cardiology or in endocrine, you're just dealing with diabetes, for example, or a thyroid issue. But when you're in the medicine, in emergency medicine, in emergency room, well, you don't have any option because anybody can walk into the emergency room and have different issues, cardiac issues, respiratory issues, abdominal pain, stress, trauma.
Well, that's why we all love shows like ER and Grey's Anatomy, because there's so much energy that's going on, and it's a different thing each time.
Exactly.
You're dealing with so much at once. What is that like to try to control? It always seems so frenetic to me.
No, but when you do it for a long time, actually you look at it as a job and a daily routine, and you don't get frustrated nor excited, and you don't get stressed out. For me, just fun. Although,
I'd love to hear you say that.
Although it has a stress,
Sure.
I don't, decline, but it's just getting to a point that you do it routinely. And if you are dealing with varieties of issues in emergency medicine, it gives you that leverage to know better, to get to know the patients better and deal with different issues at the same time. And
you have to know a lot at once, right? You have to have a lot of knowledge and be able to think quickly.
Exactly.
Which is why I'm not an emergency room medical professional.
And that's the reason right now in my private medical practice, I deal with a lot of things. I wouldn't say if somebody comes with a cardiac issue, I can't handle it, or hypertension, or anybody with asthma, or anybody with peripheral vascular disease, or anybody comes to me and say, I want to know what are my risk factors to get to a cardiac event in 10, 15 years in my life, which brings the preventive medicine.
Yeah, so let's talk about it. We have advanced preventive medicine and urgent care. So we've sort of talked a little bit about the urgent care. We can go back to that. But prevention is like this, it's been a buzzword for a while. I think people throw it around, but they don't really know exactly what that means and how important it is. And so I think it would be good if you gave us like a definition. What is preventive medicine? Exactly. What does that look like?
Well, the reason I picked the name of our practice, Advanced Preventive Medicine, is I have a passion about prevention in medicine, because ideally we have to prevent disease and pathology rather than treating the pathology. So, for example, I give you a very, very simple example which makes sense for everybody, and everybody knows about this. Let's talk about myocardial infarction or cardiac event that everybody knows. For preventive and cardiac event, we have to know the risk factors, and it's so easy to prevent the risk factors rather than waiting 20 years and get to the chest pain drama and scenarios that people, they call 911 and they end up to the hospital and they will be diagnosed with myocardial infarction.
Right.
Let's talk about risk factors. Everybody knows the risk factor for a cardiac event would be high cholesterol, high blood pressure, stress, diabetes, family history, genetics, smoking, and also using overuse of alcohol. So right. These are the risk factors. So if we have all these risk factors that they are ending up to a myocardial infarction after 20 years having these risk factors, preventive medicine, and the beauty of this branch of medicine gives you the opportunity to treat every single risk factors and orient the patient's lifestyle modification so the patient does not end up to cardiac event. Well, if they will end to a cardiac event, they're not going to end up when they're in 40s. So maybe it takes them more years.
So is that all? So you've got all those factors. Is that all diet based? Is it? Do you help? Because I think people think prevention. The first thing when I think prevention is I need to eat right and exercise.
That's perfect.
But I think a lot of people don't know what eat right and exercise are. And before you answer that, I'm going to tell the live people that we're actually going live and we are recording at the same time. So up next in a second, when you see pauses, we're going to talk about what eating right and what exercising means, because I think a lot of people don't know that. So we're going to pause for a couple seconds. And you can just look at Sam's amazing, beautiful face. Not mine. All right, so we're back. So I want to talk about the eat right and exercise. There are so many diets out there. The word diet is even something that people really get obsessed with and don't know how to define. And there's all sorts of different types of exercise. So when you say eat right and exercise, what should people be looking for?
Well, let's focus about the example that we had. Cardiac events, myocardial infarction, and atherosclerosis, which is the number one cause of death in the United States and pretty much in the whole world. As we talked about the risk factors, we talked about high cholesterol, high blood pressure, smoking, diabetes, and all of that. Genetic is something fixed. Genes comes from DNA from your parents. Correct. You can't touch it. But other factors we talked, lifestyle modification is one of the biggest thing in preventive medicine. Well, we have to see if risk factors are coming from unhealthy life. If that's the case, we do lifestyle modification. So everybody comes to me and everybody comes to a doctor. They will be counseled how we have to change our lifestyle. If you're eating out every day because of the job or right. Life situation, and if you just correct yourself and go to a healthy eating pattern, your cholesterol issue probably will be solved. And if you reduce this risk factor or eliminate this risk factor, you are eliminating one of the biggest risk factor for cardiac events. Well, there is a factor that we have, familial hypercholesterolemia. So people with defective genes,
right,
they have high cholesterol, and you can't fix this.
The poor with
guy,
diet,
yes,
right?
Exactly.
Because I think that's what happens. I think people go, all right, my doctor told me I have high cholesterol. So in order to prevent this from becoming an event, like you mentioned,
exactly,
I'm going to go on, I'll use keto, for example. So I'm going to eat high fat, low carb, and that's going to solve everything for me, because in my mind, the industry has told me that all diets will impact the people the exact same way.
Exactly. The problem is, when we do lifestyle modification, we will find out what is the problem for that specific patient.
Correct.
And then we try lifestyle modification. We tell them, okay, this is the diet. I have a set diet in the office. I give it to the patients, written in a piece of paper so they don't forget. They take it home with them, and they go through this diet. And then after we check the blood work, right? So we see that the LDL is high, we see the HDL is low, the good cholesterol is low, the bad cholesterol is high, and there's been a history of 6 months with the confirmed blood work that the cholesterols are high. So we start doing a lifestyle modification with correct diet, and then we bring the patient back, do another blood work in 3 months, and we see the changes. If the changes are significant, then we say, wait a minute, so probably lifestyle modification is working for you.
Right.
So we extend it, and we see the difference in next 3 months, the next 3 months.
And is that diet, so how does it work? Like, for example, I know that a lot of people, I'll use keto again because that is just a top of mind for everyone. But for some people, that the perception is that the high protein, high fat isn't good for them, and then they just go on it without a doctor's blood work, and they think, all right, I've lost a lot of weight. And I think they equate, all right, I've lost weight, so I must be healthy. Is that always the case? Don't you have people who are thin come in that have heart issues or other kinds of medical issues?
Exactly. This is where we are going back to the conversation that sometimes genes are defective. People, they're very skinny, they're very healthy to their mind,
right,
but when we check, their cholesterol is high, they have metabolic syndrome, which is the biggest problem these days for people, that they have high cholesterol, high sugar, pre-diabetes issue, and stuff like that.
Sure.
So we do lifestyle modification. We confirm these patients, they have issues in the level of genes, and the family history and genetic will confirm, and the laboratory will confirm as well. So for those type of patients, we educate them. There's so many good medicine out there, Ted, that we can just use those
Let's
medication.
talk about that a little bit, because I am currently on lisinopril.
Okay. Hypertension.
Hypertension, so that's blood pressure, which is also a factor.
Exactly.
I have a history, but my blood pressure has never been super high, but it was high for a while, and so we've been on that, and it's been under control ever since.
Exactly.
But a lot of people say, well, can't I just figure out how to handle that with diet and exercise? Why would I want to be on a pill? And my thing would be, okay, well, for me personally, it's easier for me to know that I'm taking that and I've maintained for all these years than worrying about, well, what if I didn't eat right this time and my blood pressure's up? Or what if I go into a pattern and I have no backup? What is the medicine part? Because I think people get really confused. So is it preventive? If it's preventive, then why are you prescribing me medicine? And I think they mix all of this up.
Exactly. Very good subject you bring up. The thing that I want to talk to you is, even in the medical books and in textbooks, if you go hypertension, right, or high cholesterol, or even diabetes, pre-diabetic condition, whatever, the very first line on treatment, it is lifestyle modification. And in a lifestyle modification, the very first thing we do, probably we have to lose body mass.
Sure.
Why? Because if we have bigger body, and if we are overweight, for example, our heart should serve more volume. So that's why the blood pressure issue comes up.
Right.
So just imagine if we have the issue of overweight, immediately it comes with a package of hypertension. When we have overweight, we have metabolic syndrome. So we have dysfunctional sugar metabolism. So patients will be presenting with prediabetes.
Isn't that epidemic? Because I want to talk a little bit about that.
It is.
So give us a second. We're going to be back in a minute because I want to talk about the diabetic epidemic, diabetes type 2, exactly. And then I want to deep dive into the addiction side of what you do in your practice.
Very good.
So give us a couple of seconds, guys. All right, so we are back, and we want to talk about, finish up on the type 2 diabetes, because that seems to be in the news everywhere.
Exactly.
And it is, people are getting it in an epidemic proportions. It's really out of control, or at least it seems that way. Is it as bad as the media presents it? And then is that all again tied back to lifestyle?
No, actually it's very true. It's very, very true. And it's very bad because pre-diabetes, if you do not treat that type of patients, they will end up become with full-blown diabetes.
Right.
And the biggest actually risk factor for cardiac issue, it's diabetes. So
I didn't know that.
Yeah,
okay.
It's very, very, very important. And the guideline for diabetes, it's changed recently. And everybody was thinking, even my father was telling me, my fasting blood sugar is normal. But the fasting blood sugar, FBS, it's not an indication to diagnose diabetes anymore. We have to understand hemoglobin A1C measurement, which is a measurement of the median of different numbers of the blood sugar in the average of 3 months, gives the hemoglobin A1C level, and that is the factor.
That's the one I hear all the time, exactly.
A1C. A1C. And A1C for prediabetes before was about 6.5. Now it's 5.8.
And they lowered it because of why?
Because we see more cardiac events, more complications of diabetes. Now the American Society of Diabetes, Associations of Diabetes, they just make it tighter because they believe with controlling the sugar and having lower hemoglobin A1C, patient will be healthier and we see less complications. So that's very important. Everybody, no matter what, they have to check their hemoglobin A1C
I could talk about prevention all day, and I'd like you to come back and talk about that, because I've got all sorts of questions about Europeans and the Mediterranean diet and all sorts of things, and how where you're from and your genes all play into it. But I don't want to miss out on the addiction part. So talk about that, because we had a great conversation prior to going live. There's a NEP talking about type 2 diabetes. There's also an opioid addiction. There's an addiction epidemic in our country. So talk about what you handle, or what you see, and then what kind of services you offer.
Exactly. The other thing that I want to talk about briefly, if you have time, is about addiction medicine. With being board certified in addiction medicine and treating patients with addiction to opioids, I love to say, unfortunately, a lot of patients, they don't become addicted to opioids because they just go buy the drugs from the streets or using the drug from the street. Unfortunately, they have medical condition and they go to doctors and they have no options but receiving painkillers, narcotics, and unfortunately these drugs, they're so addictive. So if somebody uses these drugs for a few days and not having other alternative to control their pain, they become hooked to this drug, and then if they don't receive this drug from their providers, they will end up to the street.
So that's specific questions on that.
Exactly.
I think that when people, if you're not in it or you're not touched by it, people get confused about what an opioid is. So OxyContin is one. Is Vicodin one? These are some of these that I hear. So these are the controlled substance family,
that's
right?
Controlled substance.
So I think when people hear opioid, they think, oh gosh, that's something they're buying from the street. But like you said, you're starting it with your physician usually. It's usually a painkiller.
Exactly.
And then you become addicted. There have been limits set on the number you can get, which has also been controversial because it's just been an interesting topic for people. But there's also talking about Narcan. Can I bring that up? Are you Narcan?
Yeah.
Familiar with that?
Yes.
So that's been a big push in Orlando. But what I really want to do is finish up talking about your services that you provide. So let's say somebody comes in and they are full-blown opioid addict.
Well, we have full service or I would say full clinic for opioid addiction, and all the patients that they're hooked to this medication and they know they're hooked and they're addicted and they want to get rid of it in their body. So we have full of services in the clinic to keep the patients for the day, not overnight, but for the whole day, and go through the withdrawals. So people, they get withdrawals, and the symptoms.
That usually prevents people, right? People get they've heard how bad the withdrawals are,
exactly,
and so that's a lot of times that is what will stop them, because it I've seen it because I used to work in the industry. I've seen it. We used to go to detox centers, exactly, and it is a very trying thing because your body is trying to get used to it's addicted to it, so it wants it, it craves it, it needs it physically sometimes, and physically and mentally.
Exactly right.
So you have to be under a physician's care in order for you to really go through that safely. And I think a lot of people don't want to do it. They don't want to take the chance. They think it's going to be too painful. And then, of course, my question to them is always like, well, is this lifestyle really where you want to be? Is this what you want to do all the time? And it's very trying for people, I think.
That is true. And then, as you said, the word detox, we have the full detox clinic. So we help them to go very smoothly through the withdrawal symptoms and withdrawal syndrome. And believe it or not, it is easy because there are so many medications out there, IV medication, IV hydration, and different pills. We help them all to go through the withdrawal syndrome, and after a few days we put them through programs, Suboxone program, buprenorphine program, injectable form, eatable form, based on different cases, different patients. And they go back to their life, their normal life. We have so many patients that they come and they go through this and they get their normal life back, they get their family back, they're so happy, they start working, and they have a pretty much normal life.
And I want to give a shout out. There's a lot of people that I know that are struggling with this. We talked about this prior to the show. Your life that you're leading now, you're not happy with. And it's just an existence, right? That's what it feels like when I watch people. They're in it, they're existing, they're getting by, they're going from hit to hit, they're going from whatever they're taking. They may be functioning, but functioning isn't living, in my opinion. And so at some point, your body is going to wear out. It's just going to happen if you continue to ingest all of this. And so it can't go on forever, but we're not saying it's an easy process, but if you have somebody loving and caring like Dr. Saied, that's where you want to be. I think it's really important. All right, so I want to bring you back because that's how fast the 30 minutes goes, and we have lots of questions here. So I promise you guys that we will come back and talk more about the preventive, go dive deeper, and about addiction, because I think it's on everybody's mind.
Exactly.
Sam. It's in the news, but people are really being touched by it daily. Families that don't even talk about it are being touched by it daily, and so I think it's super important. So we're going to share all of Sam's contact information, how you can reach out to him, how you can learn more about advanced preventive medicine and urgent care. We've tagged it. We'll tag it again. Sam will share it. You can reach out to him. Obviously, you want to have a caring caregiver when you are going through either one, or when you're making a lifestyle change. All right, give a quick shout out if you can to somebody who's made an impact on your life professionally or personally. We're big on mentorship here.
So I want to give a shout out to my wonderful, beautiful wife, that I have all my career, medical career, from her, because if she was not working hard enough to let me go through all the school and board certification in the United States. Again, I would never become a doctor in this country. I love you.
Oh, I love that. See? It's good stuff. All right, thank you, Sam, so much. Thank you, guys. We'll answer your questions, so will Sam, and we'll share all of his contact information again, please. And Sam, hopefully you'll be back. I'd love to have you back. We have so much more to talk about.
Thank you so much.
We love you guys. Have a good one.
Thank you so much. Have a good one. Bye.